I am BTEX, and we're going to be talking about third-party cannabis testing. This is a lot of laboratorial science goes into this, and here's my little slice of life and slice into the world of cannabis testing. Thank you, Wash, by the way, for the cool art. All right. So, as a broad overview, the areas that are required in testing in laboratories prior to sales and dispensaries, at least in every legal state that I'm aware of, we have the areas of potency, terpenes, residual solvents, pesticides, heavy metals, microbial. We also have water activity and visual. These areas of testing, though, end up having to use some pretty heavy-hitting equipment, and each one's correlated, but sometimes split between different types of instruments. So what this lecture is really going to be about is our instrumentation. So we have liquid chromatography in the form of HPLC and LC triple quads. We have gas chromatography in terms of mass spectrometers, sometimes with FIDs. We have inductively coupled plasma, mass spectrometry, so ICP-MS for the heavy metals, and we have PCR and microplating for the microbials. We'll also get into NIR testing and a bit of moisture, how the moisture is tested. Now, one thing to understand when it comes to laboratory tests is how do you actually figure out what's in a vial of something, right? You have to separate out a complex mixture into its individual components to get any sort of good quantifiable accuracy and resolution on what the sample is. And the core of this is called chromatography. Chroma meaning colors, tography to separate. And here we have a really beautiful packed column that very rare to have such vibrant colors in chemistry. But this is the term made manifest literal. We're separating out from a single solution the many different elements by some sort of principle that's affecting the different elements. So in chemistry, in either production or analysis, you have to figure out what's in it and then separate them by, let's say, boiling point, by polarity, by size exclusion affinity, or something of the sort. So there's different ways to perform chromatography, but that's the underlying study and theory that's underpinning modern chemical analysis, and in this case, molecular biology as well. Right? And how this is actually done, I think it's there's multiple ways that this is done, but in this case, this is a liquid chromatography column. And this is a bit of a simplification, but the idea is with these liquid chromatography columns, there's some sort of material. In this case, it's a porous material. So this is using on basically the principle of size and interaction with the pores. And this is in liquid phase. So that high pressure, it's pushing through a complex mixture that's usually an extract through this, and the different elements in that complex mixture are going to interact with the material inside of the column. The column is the key word I want to have taken away from here. The column will interact with the individual components of the complex mixture, and then will make sure it will help separate them out. And once you have them separated out, much like looking at a magnifying glass, you're looking at individual components instead of a singular blob of everything at once, which really helps if you want to do something like quantitate and actually have a good idea and a measurable idea of what's in your sample instead of a vague idea of like, yeah, that's like D8, right? Totally. You know, science is built on stuff more than vibes. We need to actually get numbers. So in this picture, the complex mixture is the big dots and small dots. The small dots interact with the porous material more than the big dots, so the big dots go through this column faster than the small dots, right? And you'll see this principle replicated in most of these instruments. The other one is, of course, mass spectrometers. So and finally, we need to understand the different states of matter. So if you forgot about high school chemistry, we have solid, liquid, gas, and plasma, the 4 states of matter. And those are the tools we have chemists and physicists have to work with to manipulate these materials. So on the extreme end, we have solids, which is usually how the materials come in. And working with solids and analyzing solids, there's some pragmatic issues, like it helps to have it be able to flow through a system, like a liquid or a gas. Plasmas can interact with gases or with magnets, so there's other ways to manipulate it. With solids, sometimes it's difficult to get really great results, but because that's the initial form of the material, that's very useful to have anything that can analyze it. So we have NIR, near infrared, spectroscopy, and NMR. Near infrared has a place in cannabis, but not in cannabis laboratories because it's just not quantifiably accurate enough for the relevant legal statutes. And spectroscopy is widely used, and you'll see that some of these instruments are basically just fancy flashlights with a detector. But there's a lot of science that comes in before using that fancy flashlight, because spectroscopy, in reality, I think it's a surprisingly simple concept, but again, a lot of science can go into it. And I threw NMR in here just as a discussion point, but we don't use NMR in cannabis laboratories. That's kind of overkill, but those would also be using to analyze possible physical samples. Now, liquid chromatography is going to the liquid phase, so we were talking about the liquid column earlier. So you get something in liquid phase, you run it and analyze it in liquid phase, which we're going to get to this later, but it's usually using some form of, after the chromatography, using some sort of spectroscopy or fluorescence or something, light, just looking at it with a fancy flashlight. Gas chromatography is doing this in gas phase. So if you can actually boil it off and have it get into the air, then you're going to probably want to do it in gas phase chromatography, where we have multiple detectors, but we're going to be sticking on mass spectrometers and FIDs in this case. And this is incorrect. Sorry, I should have changed this. This is inductively coupled plasma. This is an ICP-MS, where it gets something extremely hot, because that's the magic of plasma, where then it shreds off all the electrons. So all the chemical bonds are shredded away at 10,000 Kelvin, and you can get a really good and accurate elemental signature from, utilizing the power of the sun for your pot. Now, the broadest, and I always start with potency because that's everybody's question, right? How do you get the THC number on this guy? So that answer is the HPLC system, high performance liquid chromatography, or high pressure liquid chromatography. Which term is correct? Honestly, I think these are corporate branded terms. So sometimes you'll see that they have very similar terms but are slightly different, and it also leads to a lot of confusion even among professionals as to what the specific verbiage is. And the answer to that confusion is because the different companies have very similar terms referring to basically the same thing, but legally speaking, not the exact same thing. So I also am not, by the way, I don't have any financial incentive in doing this. We don't make any money here at TGen Tech. We just spend money here. So I'm not getting advertised I'm not giving sponsorships or being advertised by anyone. So I did my best to use very generic examples, but these are all like from some sort of companies. I don't think they'll be too upset about the free advertising, but if they want to have their logos displayed, they got to pay. All right. So what we have here is our liquid sampler. So the liquid sampler, it works off of, we talked about the porous columns, right? And we also want to talk about polarity and utilizations of solvents. So these guys, the main solvents here are ACN, which is acetonitrile, methanol, and water. The idea is that these are different polarities of solvents. So from a little less polar to extremely polar, and you're putting material onto the absorbent column, right? So think of it as a paper towel, and then you're washing it with a different solvent each time. And theoretically, if you had like some sort of, let's say, ink, it'll wash off the solvent of the ink before it washes off the particulate, the actual embedded pigment. So you're able to do, theoretically, individual components of a complex mixture one at a time. Now, of course, how much solvent do you use of each? Like, is there some sort of ratio? The answer is yes. There is a ratio. In fact, it's the entire ratio. And this goes a bit too beyond my understanding because this is in engineering, but these guys use some very interesting quaternary pumps in order to develop a fluid gradient. And if you think about it really closely, it's actually difficult to have a fluid gradient from 100 to 0% of anything without it being in fractions, right? Like let's say 10% steps, where you have 10 steps from 100 to 0%. These guys use some schmancy mechanics to make sure that the gradient is smooth throughout, so you can actually get a pretty precise detail of when it's eluting, which is to say when it's getting off of that absorbent column, and then you actually can get things separated out very efficiently. The other reason it's called high performance and high pressure is because this is done at extremely high pressure, at least in my opinion. These things operate routinely at over 100 psi. I believe high pressure UHPLC, ultra high pressure performance liquid chromatography to go up to like 10,000 psi. I don't do this super routinely, but this is using the magic of organic solvents, high pressure, gradient flow control, and definitely a lot of sample prep. Sample prep, sample prep, sample prep is extremely important to all of this. Now, some details, if you actually look this stuff up, is like C18. Everything is poroshell C18, something like that. The C18 is referring to a carbon count. So in octadecyl silane, and that's the material used to make the absorbance material that operates at the scale relevant to whatever analytes we're talking about. And there's a whole catalog of stuff. I'm being a little vague because there's actually a lot of these columns. Now in cannabis, there tends to be like 1 or 2 columns that are used. One for potency, one for pesticides, actually 2 for pesticides, but in reality there's like hundreds of these, and these are specialized usually to the type of analysis you're doing, or at least in a more narrow range of chemical behavior that you can define your analysis, because some analyses are very unknown and novel. All right, and here the problem is the terpenes, bubbles, and particles, because this has very thin tubes at very small diameter holes at very high pressure. So anything like a bubble, it's surprising how much surface tension air bubbles have. I remember watching as a child SpongeBob talking about how nobody hates bubbles. Well, I'll tell you, scientists hate bubbles. Man, they really screw things up. And then we have terpenes, which is an interfering compound with cannabinoid analysis. So it's just, again, it's going back to that this is a dirty biological matrix, so other things that are in the biological matrix interfere with your attempts at quantizing your analytes of interest. In this case is the potency, so the delta 9 versus THC-A versus, let's say, delta 8 or CBDV, CBC, all the other cannabinoids. Now, and of course, after the whole thing with the column, the actual detector is spectroscopy, so UV, ultraviolet, or DAD, diode array detector. So there's different ways of producing light and then detecting that light, because things will absorb different light waves specifically. So I just use the term a very fancy flashlight just to be extremely dismissive to what's actually pretty sophisticated chemistry. But this is how you do the potency. This is how you get that number on the dispensary packet, which of course you'll conveniently ignore because you just are getting what's affordable and what's available, right? And what feels good. Now, this is the gas chromatography system. This is what I actually have my specialization in, and this I can do multiple lectures on separately. And this is where I'm currently getting my bread and butter. So this is what would be called a subject matter expert in, particularly in cannabis, but I do a bunch of other things at this stage. So with residual solvents, we're doing the terpenes and residual solvents. Terpenes is characterization. You know, the smell of it has a bit of a therapeutic effect. Residual solvents is the safety panel part of it. And this is testing in gas phase. So the gas phase, you have to introduce it somehow onto the sample. We have largely headspace and ALS, liquid sampler injectors. The headspace is sampling the gas. The liquid sampler is taking the liquid and injecting it into something very hot, then produces a gas, and then it takes that gas and samples that, right? So a lot of the times in commercial labs, they prefer headspace because it's a lot cleaner. And that's one of the big advantages of it, because it's removing your gas from the matrix and samples, which, let me tell you, cannabis is oily. It's dirty. It's hard to work with. It gums up the machine. There's waxes and oils and a whole bunch of things that are more difficult to work with. And in this case, we just want to have the gaseous aromatics, the semi-volatiles, right? So the liquid injector is not used as much in cannabis, but in order to do wider range analysis, you oftentimes need to use a liquid sampler because it's, quote, more versatile of sampler. You can get more onto the system. It gets at a hotter temperature. A lot of details like that. All right, and then mass spectrometry and the FID versus others. There's a number of different detectors on this, and we're going to have to talk about the mass spec for a bit. The mass spec is something that allows for mass selection, and it's one of the modern miracles of chemistry, which turns out to be over like 100 years old at this point. Mass spec technology is, I believe, from the it's around the World War I period, if you can believe it. So mass spec, it's basically once you turn some compound analyte into ion, which has a charge, right? You can affect it with magnets. So then once it has a charge, you can use it called a mass selector, which is a very fancy magnet, in order to choose things within a specific range. And because it's a charged molecule, if it hits a metal plate, a very special metal plate, it induces a charge which a computer can pick up. And because computers operate at a very quick time scale, you can actually get a very clean, quantifiable, and accurate resolution on a very complex mixture. And it gives certain things like ion selection, which in comparison, an FID is detecting how something interacts with a hydrogen flame. So it's detecting the electron flow, so the electronic current that is developed from things interacting in a hydrogen flame, but from that you only have a single variable to work with, while the mass spec has a mass charge per time per signal, so you have an extra dimension to work with, which helps a lot with selectivity and allows to deconvolute, simplify a complex mixture so you can actually get quantifiable accuracy on certain points. And multiple of these systems use mass spectrometers. So in modern chemistry, knowledge of mass spectrometry, I think, is pretty critical in anything in terms of quality assurance or quality or analytical chemistry of any type. FIDs, though, are workhorses, and they're found very commonly because they're cheaper, and they have definitely their advantages. And when they work, you want to use an FID. But a lot of stuff is mass spectrometers now. There's a lot of other detectors, like we were talking about. There's like spectroscopy type detectors, but there's also things like ECDs, electron capture detectors, and other things that have some advantages and disadvantages. But a lot of the field in chemistry has condensed into mass spectrometry and FID. I also wanted to make a side comment of this is where all of your helium is going, and this along with NMR systems, because they use liquid helium for cooling. This is this I guess is an appeal to try to stop buying helium balloons for birthdays. I know they're really cool, but this is actually, it turns out it's pretty important to quality control in a million different industries. Seriously, you have no idea how common these mass spectrometers are, and a lot of the times, at least on the gas phase of things, they do run way better on helium. So not really sure what we can do about that problem, but here's me chipping in to try to help. Now, pesticides. Okay, so we were talking about HPLC, liquid chromatography equipment. We're talking about gas chromatography that's connected to a quadrupole, right? So let's smush them together and let's just double it up, right? So what happens if you have an HPLC that's connected to ionizer, quadrupole, collider, and another quadrupole, right? They call it the triple quad. So this is... Sometimes in physics, it's really hard to get the result that you want. So then if something works in a way that you need it to work and you just need a stronger result, you're just going to double that process one after another, right? It works in distillation in theoretical plates, and it works here as well by just stacking extra quadrupoles. And I think there's even like octopoles and hexapoles and other things, for even greater resolution of these materials. So this is definitely probably the singular most expensive part of the analysis because of the type of equipment that is actually needed here. Where the pesticides, the pesticide list varies a lot by state to state, but it's generally speaking the most stringent area of testing that you're going to be looking at, especially in terms of cost of analysis. So because of this, and also honestly, I think this is a cultural artifact of the cannabis industry. There's a lot of what I call like kind of hippie sort of idealism in usage of chemicals, which honestly, as a chemist, I'm not fully against. So they use like CO2 purging and neem oil, very popular, to not run afoul of the pesticide testing. Although I do have to state that I'm not on the growing side, so I'm not even going to pretend to know much there. I'm talking about the laboratory sciences, so if I keep speaking here, I'll probably say something wrong. And but this is the instrument that really makes sure that they are making sure they're not using any illegal compounds that are harmful to the health, because that's definitely one risk factor, is using poor pesticides. Because if you're smoking it, right, where does those pesticides go? Into your lungs, and it's volatilized through flame, so which is a pretty potent volatilization mechanism. Okay, inductively coupled plasma. This is definitely what I call the most hardcore area of testing for cannabis. What it starts with is you take your cannabis sample. Oh, this is testing for heavy metals, by the way. So your arsenic, mercury, cadmium, lead, whatever else they want from you. The samples are taken, so this is cannabis flower or otherwise, and they're put into aqua regia, which aqua regia is hydrochloric acid, nitric acid, and peroxide solution. So this is the strong stuff, the 30% stuff, which makes for a very caustic, very acidic, and very oxidizing solution, which then you put the flour in, and like any good chemist, you throw it in the microwave, and then you boil it extremely strongly in a Teflon tube at high pressure. And that's what the system on the right is. It's our microwave digester. And it gets not everything, but basically everything short of Teflon into a liquid phase. So there are a few things that can withstand that caustic solution, but aqua regia is called that because even gold, which is an inert noble metal, it will still be reduced into liquid form in this process. So you take an extremely acidic solution and then you spray it. It gets it into an aerosolized spray, and that is then directed into a plasma. The aerosolized spray is used, it's using an electrospray, inducing a coulombic explosion to get it in a finer mist than you would get from, like, let's say, a squirt nozzle. And then we have the plasma, which is operating at 10,000 degrees Kelvin, along with the electron flow properties of plasma, that then rips apart the chemical bonds. So any molecule here is ripped to its basic elements and given through a quadrupole, and which then is able to give a very surprisingly accurate and sensitive result on your metal and elemental analysis. We're talking, like, I believe they're down to like femtograms. It's a very small amount, and so they're using the power of the sun to make sure your pot is safe. And this is definitely probably one of the bigger hazards in the lab because of the caustic solvents that are used. But it's also honestly the coolest, one of the cooler instruments to talk about. Just wear your safety glasses, y'all. All right, microbials. So I'm a biochemist, so I do have a bit of background in this, and I did spend some time here. But this is probably one of the less glamorous parts of cannabis testing, which I'm going to be honest is not a very glamorous field to work in to begin with. So we have plate enumerations and quantitative qPCR. The plate enumeration is the plates in the middle. This is the old school kind of stuff, right? The PCR is here. Now, if you know PCR, polymerase chain reaction, that's something that you may have learned even in high school, and it's a way of amplifying genetic material, so you have more genetic material, because that's the way DNA works. So this is a specialized instrument that does the amplification for you, and using some assumptions, it's able to do quantification, because if you can make assumptions about initial states of genetic material and it's an amplification rate, and if you can measure it accurately from beginning to end, then you can get some pretty reasonable quantification assumptions. Now, it's technically, theoretically speaking, may have some less it should be accurate, but it may have some arguments against the accuracy. So in certain states, they still require plate enumeration because it is based upon initial colony counts or initial cell counts developing colonies and such, where sometimes I guess new technology has to prove its worth before it's utilized for everything. But these guys are being used in yeast and mold, coliform, E. coli, salmonella, and mycotoxins. So yeast and mold, and I believe coliform is used in the plate enumeration, while the E. coli salmonella is used in the qPCR. Mycotoxins is something that ideally is used in LC systems and HPLC systems, but or was it, no, those are on the LC triple quad system, sorry. But there is something called ELISA that oh wait, sorry, this is on the next slide. But there's a lot of pipetting in microbials. And the reason why it's not necessarily the most glamorous is because these are live cultures. You have to keep them alive. You have to incubate. You have to fridge. You have to freeze them appropriately, or you're going to ruin your work. It's a lot of precise pipetting that's very easily contaminatable because you're a human being and you're a walking source of contamination. So it's not the easiest work. It's very repetitive. It's difficult to. It's very easy to screw up, and some of these things are actually dangerous. They're working with live cell cultures of E. coli 0157, right, which gives gastric ulcers. So with the gastric ulcers, you have blood right in your stomach. This does actually can potentially kill people. Salmonella, I've had salmonella poisoning before. It's not pleasant at all. So it's awful that a very common hazard in work can put you out for days at a time. Chemistry does have its dangers. So Microbial is no exemption to this. And automation is something that I think is worth consideration, but it's also demonstrating how sometimes buying people's time is cheaper than actually automating. Because we can maybe in the Q&A section, but the labor in the sciences is not as well paid as you would think. So automation ends up being stymied because it's just not worth the money. Now, NIR, moisture, and ELISA. So this is where we're getting outside of the laboratory testing, but it's worth discussing, right? With NIR, near-infrared systems, we have, this is used for moisture or cannabis test, or the potency testing, sorry. This is a non-destruct test, so you could just take the flower, grind it up, throw it on there, and there's a lot of benefits to it. Unfortunately, in terms of, for all of the states that I'm aware of, it doesn't have the quantifiable accuracy and the sensitivity in order to guarantee the 0.3% and the 3% delta 9 THC ratios that qualify products to be quantified as hemp or non-hemp products, right? So NIR is useful, but it's not used in laboratories because it's just not quite sensitive enough. But you'll see it in maybe some grow operations or some places that are very caring about their on the spot tests of ratios of the cannabinoids. We have our moisture meter, which is very easily just boiling off the water and measuring the rate of change, which gives water activity. And this is, if you thought that pot labs smell like pot, they do. They absolutely do, and it's because of the moisture meter. These things are pretty useful at what they do, but they boil off all the terpenes alongside the water. So this is where the intense smell comes from. And I swear I developed a mild allergy working in those labs from partially these things and the purified terpenoids. So these things, sometimes you got to put in the fume hood. And ELISA. ELISA is definitely worth talking about. Emission ligand immunosorbent assay. This is basically using a plate with emission-bound antibodies on the bottom of a well plate, and you pipette them using reagents and a specific set of instructions. And it gives you actually a pretty reasonable, quantifiably accurate result. And the equipment used to quantify it is a UV detector. So it's a very basic spectroscopy. Again, very fancy flashlight, and this is definitely a simpler version of one. So in some ways it brings down the cost a lot, and they're really not that hard to use as long as you can pipette consistently and accurately. But they are more expensive. These guys are a business. They need to make sure that they're making their money, right? So these things, they try to offset this to the big instruments, which you have to have anyways, because this is an additional cost to these labs that is definitely great to fill a gap in a lab, but people ultimately try to not use ELISA for a lot of things and try to use some sort of instrumentation, right? And in this case, like we had the qPCR a moment ago, and ELISA can be used for things like COVID tests. That's probably how that's how your COVID tests work at home, while qPCR has greater verifiable accuracy, and that's what if you send a COVID test to a lab, that's probably what they're using. My headset's giving me some issues with the eyes, so sorry for the evil eye, everyone. Now, Finally, this is something that is extremely important to understand when it actually comes to the testing regulations. Each one of these states are different, right? And who actually sets the regulations? It's the important to ask the question: who, what, when, where, and why. There's been the cannabis legalization rollout has been going on for about 10 years, give or take, and different people and different voices have their say in it. This is ultimately a democratic process, and people have been voting in for federal legalization. Huh? Sorry. Oh, is everything fine? Sorry, it looks like we had some technical issue. Okay, so we have to ask the question: who, what, when, where, and why, because ultimately this is a democratic process. The American people have been wanting to have legalization, at least in their current states, and in the majority of states now we have some sort of cannabis program. Not full legalization, but pretty much, if you're willing to jump through some hoops, in most of the U.S. you can go into a store and buy cannabis. So who is actually wanting and setting up these the regulations in cannabis testing? It's going to be state legislatures trying to do their best to get references of how this testing is done, which, if you think about the closest types of testing, it's going to be things like tobacco, food, and pharmaceuticals. So each one of these states, from legislatures who are not themselves scientists, are trying to interpret scientific procedures and scientific documents and data and make something that's quote equitable in the cannabis market to those who want the cannabis market and those who are against the cannabis market. So there ends up being this very, in my opinion, strange and frustrating for almost all parties of how to push forward a legal cannabis market. But who is the quote of a sign of a good negotiation is everybody's a little bit frustrated, right? So we are progressing from what I'm hoping I could call a post-drug war America, but unfortunately I'm not really sure if I can say that, but this is progress compared to what it was in the past, because this is bringing in tons of cash revenue. There are some complaints about the health and efficacy of this, and that's where a lot of conservative political pushback comes from, but there are some indicators that it is not, destroying society as some feared. We have a lot of different examples across the United States here. Now, as a quick note, this map I got from Wikipedia. I know, a wonderful source for a scientist to use Wikipedia, but this should be up to date. I grabbed this last week. So all of these different states have different models of what they're trying to implement as the ideal cannabis market, and I do believe I'm uniquely well qualified because of my current uniquely well qualified to comment on the different rulings of cannabis in cannabis law across the United States, because in my current job I was traveling across the entirety of the United States setting up different laboratories, and there's very few people who have that privilege to actually have to interpret and work through all of the different legal interpretations of what safe pot is. So the big one that I always need to talk about is California, because they were the biggest and earliest market in the cannabis legalization effort, and they definitely tried to establish themselves as a forefront of the industry to set safety standards, and they definitely kind of stereotypical to California fashion, they definitely did it. If anything, I would say it's a little bit over encumbering, and the biggest criticism was that a lot of the laboratories and such were having a difficult time following it initially, and there were some more specific problems that made the whole thing less effective. But overall, this is what a lot of legalization ended up being based around, is California legalization. And they borrowed a lot of their testing requirements from similar things like tobacco and food for pesticides, USP 467 for residual solvents, and they were using pharmaceutical standards as a reference point. But it's very difficult to apply pharmaceutical standards to a plant, because a plant is not pharmaceutical. It's a very complex mixture. It will have a lot of interfering compounds. So some of these tests ended up being very difficult, and this is why I have a job, because I could actually do the difficult things and make it work. All right. I have to, sorry for twisting around, I have to keep a certain position for my gear to work. Now, I grew up in Vegas, which is a very tourist heavy thing. So California wanted to make a show of like what is a quote good market, right? Vegas wants to make money. So compared to it, it's in some ways the testing is extremely simple, but in some ways the testing is extremely expensive and difficult. And I think that was partially to be like, well, we can be simpler than California and still be profitable. The labs in effect are a bottleneck towards the economics of it. So if you make the laboratory testing expensive and difficult, then you're going to increase the cost of pot, which then you can tax because it's a tax percentage. So the more it costs, the more tax revenue you can get, because hypothetically people are going to buy pot no matter what, especially in a place like Vegas. So they tried to roll it out as best as they could. And oh boy, the stories, man, the early days of Las Vegas, there was so much corruption and just the rules weren't followed at all for a while. There was absolutely no way for them to keep up with the demand, and it was a complete mess. Nobody really knew what they were doing, and it was a green wave, right? In more ways than one. Everybody wanted to get their paycheck. We have shout out to Oregon and Colorado, because one of the big things that I definitely need to point out is that those states you can actually open the cannabis jar and smell it, which if you're buying at a dispensary and you get a Mylar sealed bag, so you can't see it, you can't smell it, you can't really feel it. Some states they don't even let you touch it if you don't purchase it, right? So having the ability to actually open up the jar shows that these states actually cared a little bit more about the end consumer than other ones, and because that's actually what you need in order to have an honest conversation of what you're buying. Otherwise you have to go off of labels, which there's a lot of confounding factors that may cause the labels to have incorrect or misleading numbers and values and statements and yada yada. But there it shows that it's there was more influence from people who are in the cannabis industry. Of course, it was the black market cannabis industry veterans, but it gave that input made a huge distinction, because other states you can't do that, and I think that's actually a notable problem in this industry. But I do think they kind of went a little overboard on some things. I think the safety profile of cannabis, and in terms of the lot of safety, the safety panels that we have to do, like, I don't think anyone's actually using dichloromethane for solvent extraction. I don't think that acetonitrile is like a major concern in actual cannabis, because that's more of a gotcha for the labs, because the labs will use acetonitrile and dichlo, right? But some of these safety tests I think are a little on the overbearing side. But can't lie, when you go into a dispensary in these states, it actually feels like the way you'd expect it for a dispensary. And then I want to throw in Utah and Texas as an opposite example, right? These are red bastion states. These are states that don't want cannabis. They don't. But of course, this is a democratic country, and a lot of the constituents in those states do. So surprisingly, Utah has a medical program, which 125% tax rate. You buy something at $100, it comes out at $225, right? And then Texas, which actually does have, maybe they changed this, but I actually thought they did have a medical program, but it's still very restrictive, right? Because they want, like, keep the kids away from the pot, keep the stoners from driving, keep the hippies from having their jazz cabbage. So their state legislature, their legal politics do reflect that. And I did have I have looked at the proposed language in the European cannabis laws, mainly with Germany, right? Germany, they voted to pass their cannabis laws a couple years ago, and if I understand correctly, it was just this year where the market actually opened. So their laws are actually a little bit more restrictive than, if I understand them correctly, and I had the correct documents, they're more restrictive than the American testing. So I made the statement of pharmaceutical testing on a plant. This guy is a little, they're even more towards that direction. But we'll see. Europe has a very different culture, so we'll see how it rolls out. They are largely anti-cannabis by my understanding, but like, society is a democratic process, and they've definitely voted for these things to happen. So the future is green, and I do think these things will end up happening, but it's going to be a bit like passing a kidney stone, slow and painfully. Oops. Sorry, and ISO 17025 validations proficiency tests. This is something that in the United States, this is how you actually qualify and validate laboratories as being able to do as they say. ISO 17025 is basically a documentation standard that the labs have to adhere to and be audited that they're adhering to. Validations are something, and proficiency tests are generally a part of validations where you have to actually prove the type of testing that you do is actually effective and is actually able to do what you say it's doing. One thing that outsiders may not be aware of is usually in the chemistry fields, usually these tests are provided, or there's some sort of documentation that allows you to copy somebody else's work, right? The EPA has a bunch of standards, like the EPA tests have a bunch of different numbers and they tell you like what it means, like 8260, 8270 is like petroleum and diesel testing, right? So it gives you a reference point to how to do the testing, and all the labs end up having a very similar or identical procedure. That doesn't exist in cannabis because it's federally illegal. So the EPA, FDA, any organization, if they even exist anymore, would be able to come out with some sort of testing protocol because you can't use federal funds for something that's federally illegal. So in terms of the politics, safety, and profits, out of these three, guess which one is really being thrown out the window? It ends up being the safety. And even though the testing is very stringent, because it's so stringent, people don't necessarily always follow it. I can tell you at the early days of the cannabis industry in Vegas, the rules were not being followed really at all. So as much as it is to say if we have tough rules, it'll make things safer, if you can't follow the rules or nobody's willing to follow the rules more accurately, then you're going to have people shortcutting those safety requirements anyways, which leaves the end consumer at risk, and it doesn't benefit them, and it really doesn't benefit anybody other than the people who have the most to profit from this. But it really does show like the desire for profit really undercuts the effectiveness of these programs, let's say. And yeah, so it kind of begs the question of who's actually making the decisions here, because there is a political pressure in order for these to happen, but then how do you define legal pot, right? And they really are making this like a kidney stone. They're figuring out the ways to stymie the rollout, make it difficult, make sure that, especially in the Las Vegas market, to give it into the few hands that already control the biggest slices of the pie. And I guess that's human nature and human society, but from the laboratory perspective, some of these things get a little bit more obvious. And this is the laboratories are definitely the bottleneck of the industry. So I do see sometimes I suspect I see higher up on the mountain, and I see more of the valley view than most people when it comes to this sort of stuff. All right, I did go a little bit over time, but we finally got to the Q&A. Thank you everyone, and I hope you enjoyed the lecture. Now, my NDAs and my time in the cannabis lab are done with, but I need to be careful of any sort of, like defamation or whatever. My current job I'm not willing to talk about, unfortunately, because I still have NDAs there, but I am a subject matter expert in gas chromatography with my background being largely environmental and cannabis, but I've also been doing a bunch of things like alcohol, plastics, petroleum, beer, so I'm more broad in application now. I have experiences in all parts of the cannabis lab, though: LC, HPLC, Microbial, the ISO 17025, doing the validations, dealing with auditors. Great times. So I open the floor to any questions, and if you're on stream, please type out your question, and we'll have a moderator deliver your question for you. Okay? Action limits, sensitivity, and such, because it all depends on what you're looking for and what is to what sensitivity limits you need. All right, so basic question. Why can we not do quantification of cannabinoids on a GC FID, right? FIDs are very capable of the detection. The columns can separate out the different cannabinoids. The reason is because the decarboxylation of THCA, the acidic form, goes into delta 9, the reduced form, spontaneously when it goes into the inlet because of the high temperature. This happens at 100. It starts happening at 105 degrees Celsius, but 150 it happens pretty quickly and spontaneously. So at an inlet temperature of, let's say, 300 degrees Celsius, you're going to get spontaneous decarboxylation. So that's the justification for, in just the potency alone. That's why you need to do it through HPLC, which is a more expensive platform than a GC-FID. Inversely, some of the things will not go into gas phase readily, so you cannot do, let's say, metal analysis on either an LC or a GC, so you need to bring in the ICP. The pesticides are, one way to think of this is ionization, right? So we're talking like how strong are you trying to ionize something, bring a charge to the molecule? Because at mild ionization, you may not do a lot, like you get a single proton. At hard ionization is the ICP, where you're just ripping the molecule apart. You just tear it apart, and you're giving it a charge from the plasma. So you can't do everything on one instrument as one would hope. These things do have to be kind of pre-built and targeting your zone, your analytes of interest, which includes sensitivity. One comment that I also like, people ask me how feasible is it to do residual solvents and terpenes on the same injection, on the same instrument, on the same column. Hypothetically, it's doable, but because the concentration reads are so vastly different, it usually exceeds the linear range of detection to do it in a single injection. Usually you have to do it in multiple detections. Of course, a lot of this depends on what your state requirements are. What are the numbers, your action limits is what I refer to them. What are your actual goals here? So if they're easy, you can use less instruments. If they're difficult, you gotta use some really expensive stuff. And you'd be surprised, like the GC triple quad, there were two analytes, two pesticides that were used on the GC triple quad, all right? Ace-quinosyl and pentachloronitrobenzene, right? And that's like a $500,000 instrument for two analytes. All right. I think that answered that question. Hold on. Do we have anyone in the VR audience? I don't want to supersede the people here. Okay, I was looking at Sky, so, hold on. Sorry, technical issue. Okay, I'm back. I'm sorry about that. VR is a wonderful thing that just always works perfectly every time. All right, may you repeat your question, Sky? Yes. Yeah, so the question was, how does a inductively coupled plasma system work, the ICP-MS? Each one of these instruments, by the way, would definitely be worth its own lecture, because the technology behind them, each one of them have their own niches and nuances, and being a good analyst requires a decent amount of knowledge on any one of these systems. So there's always the comment, you want a couple of years on any system to actually say you know the system, right? So with the ICP-MS, I talked about the digestion, where you're getting into liquid phase. Once you get into liquid phase, you need to get it into some sort of gaseous phase in order for it to interact with the plasma. So the system that I was familiar with, it uses ESI, electrospray ionization, which is something that's also used in the LC system. So it's using a method of acidifying. It's already very acidic, and then it's using an electron flow to basically induce the it's to reduce the surface tension during the spray, which causes a greater atomization during the aerosolization process, which makes a very, very fine mist, more so fine than if you used a squirt bottle. And that is able to then go into the plasma at a rate, and you can control the rate that's being introduced into it. And the plasma is then what's ionizing the actual materials. Because of the high temperature and electron flow, it's going to cause the molecules to be ripped into their individual elements. And those individual elements are then, because it's in a plasma, it's able to be affected now by magnets. So there's repellers and pushers in order to push it through a quadrupole. And that quadrupole acts as a mass selector. And that mass selector then will give you a quantifiable, will remove everything And this happens very quickly, by the way. So you're doing a scan, like very, very quickly. You're going through, and then it's getting it's selecting out the different masses, which in this case correlates to elements, right? Because it's so thoroughly ionized that it's no longer in its original molecular form. It's down to its base elements. So those elements are then hitting the detector, and you're getting a quantifiable signal, which a computer calculates. And this is just surprisingly, it's extremely sensitive this way, because when you have strong ionization, every atom that has a charge and it hits the plate is introducing more of a charge than, let's say, an LC, which is using, quote, soft ionization, which is doing it at room temperature with mild acids. The ICP is using really harsh physics in order to get this stuff to be ionized and viewable by a detector. It's there's an electron flow through the plasma, so it should be inducing an ionic charge basically, and because it's at 10,000 Kelvin, it's also inducing the elements to be ripped apart. So it should be it should be the atoms, because they're charged and flying through a magnetic field. They're hitting the detector. Now this system does require maintenance and cleaning, but the actual amount of cleaning depends on what we're doing. It ends up not being as much as you would think, but there's still physical matter hitting the detector. Okay, so the question was, there's a number of solvents that are used in in chemistry laboratories that end up being reclassified as hazardous to use or requiring greater safety protocols to use. Is that a good summation of like, and what do I see phenomenon that in labs? That happens. That happens a lot, and that happens a lot more than people realize. But unfortunately, I decry that we live in a culture and day where the safety and risks and the costs of these things are passed off to basically everyone else other than those who can actually do something to control the exposure of it. And this is something that does ultimately affect everyone, because dichloromethane, DCM was the comment that Wash was using. Dichloromethane is also used as brake cleaner, is a common term, and in the past it was used as tetrachloromethane, similar but even more toxic because it's a potent firefighting material. It doesn't burn. So there's a bunch of these chemicals that are like this, and us chemists, we do have the training to use dangerous chemicals, but there is a issue, and I do see of this as a general cultural issue that has been propagated through many mechanisms, but there is a work culture of a cavalier attitude towards safety, and if you're against it, you're kind of a detractor and you're slowing things down, and I think that's actually a massive problem that's affecting, at this rate, everyone. And the question was about chemicals in laboratories, but this is happening in a lot more places than you would think. I'm going to bring up the Teflon issue, PFAS issue, polyfluoroalkyl substances. So that includes Teflon. They say that at first it was OFAS, but then it became the whole classes of Teflon, which this stuff is useful to use, but also turns out is now in the water to the extent that it's in the rainfall, and the cost to clean this up is exceeding the GDP of entire nations. It would be like $10 trillion to clean up the global water supply from Teflon contamination. We don't really have a solution to any of this. So people should be worried, but they're not. There should be a solution in place, but there won't. And even saying that these things are more dangerous than we initially anticipated, what does that actually change? So now I have to work through everything in a fume hood, right? But if the businesses aren't equipped for the increased use or the now more hazardous usage of the same materials, they're not going to actually change their procedures. And if there's no labor rights to actually complain and do something about it, being like, hi, I'm exposed to carcinogens on the daily, can I go do something about it? There's no real recourse for employees, because then, like, okay, you want to take him to court? Well, how about like paying your rent and going, are you going to get another job? Because they're not going to be obviously paying somebody who's now suing them. So, and I can tell you, I've done environmental chemistry. This is something that affects everybody. And environmental chemistry, what does that entail? I'm testing your soil. I'm testing your water. I'm testing your air. Okay, this is stuff that it doesn't matter where you live. Do you know if you ever lived on a train yard like 100 years ago where you live? Because the mercury is still going to be there. The rain doesn't wash that out. The transformer oils have been laced with PCBs, and they just dump this stuff out. PCBs don't degrade. They're carcinogenic. They'll last in the environment for a while. Now it turns out PFAS is an issue. They make the joke that everything causes cancer. It's like, well, you should probably be upset about that instead of making a joke about it. So yes, wash, it happens. There's really the mechanisms to actually do something about it don't actually happen. So it just ends up being some of these situations are very dangerous. I was put in the hospital for my job. I was exposed to dichloromethane to the point where I got carbon monoxide poisoning. And you know the first question my employer had after that? Are you coming to work tomorrow? Yeah, they don't care. Yeah. If you die, you're going to be replaced in a week anyways. So what do they care? And oh yeah, and good thing we just what EPA and OSHA are being defunded. So who do you go to now? Even the DEI attack is also dismantling the labor board that you go to for employment discrimination or anything like that. So I really this for in terms of a chemist in the United States, I think this is a more dangerous time than ever before because I was already at a loss of what to do if I was in a dangerous situation. Now I'm even more at a loss. Anyways, I think I answered that question pretty thoroughly. Do we have anyone from this audience? Personally speaking, no. But there's the pragmatism here definitely came about in the so we're in a post-drug war sort of society, or I keep using the term post-drug war, right? Well, we're trying to move away from the drug war. Legalization of cannabis is one of the things, but there's a lot of questions about some specifics of what should be required in the testing, right? And we're dealing with politicians who may not have the deepest depth of knowledge here. So the Farm Bill, for example, they have specific language of if the plant has less than 0.3% THC, then it is considered a hemp product, right? But what specifically does that mean? So it becomes a thing where people suddenly actually do want to have it differentiated because it can allow things to be sold as hemp products potentially. Because if you didn't know, Delta 9 THC is the decarboxylated form. The vast majority of the cannabis, of the oil, of the THC in the cannabis plant is THCA, the acidic form. So when you smoke it, it decarboxylates because it's hot. When you bake it, it decarboxylates because it's hot. You know, at around 105 Celsius is when the process starts. So if you bake it, it's going to get hotter than 105 Celsius. And the testing, you need to differentiate it. I think that really GCFID would have been very able to do total cannabinoid testing. And there was some large arguments for it at the beginning of the market where that was all that's necessary. But better isn't the right question to ask here, right? What's more profitable and what's better for the people that are still stuck in a halfway type of negotiated, I don't really think this is a real negotiation, but a negotiated system nonetheless of what should be legal and what shouldn't be legal. So the differentiation of THCA from Delta 9 THC is a technicality that is convenient to some people to use, but in terms of the actual efficacy, I can talk about the differences, but the differences aren't significant. But yes, there is actually a metabolic difference between ingesting THCA versus decarboxylated THCA, Delta 9 THC. So the THCA has lower binding potential to the receptors, but you're only going to really feel that if you're eating unprocessed cannabis, so like raw flower, because most processes, unless if you're doing it at a cold temperature or doing it at a warm temperature, that'll auto decarboxylate. Like if I boil butter, right, I just throw some nugs in butter, boil it for a while, it's going to get above that temperature where it's going to decarboxylate. So most of the time it's being done for you, but there are some medical uses for it. But for general market, I would say that it shouldn't be needed. Some people do specifically want to have a good idea of what the THCA detailing is. So really, I feel like I just went around in circles saying, yeah, it's kind of weird like that, isn't it? So I'm pretty sure that was a brilliant I'm not even sure if I answered the central question, but that's really all I can say about the differentiation between the two. There's reasons to do it, but they're not. I would say for practical efficacy, there's not a tremendous reason to differentiate THCA from delta 9. It would make the testing a lot simpler and easier. And well, like the consumer safety would be virtually the same. Yeah. Um, I think there could be a lot cheaper and more effective ways. I think looking at the tobacco industry could be a good relative closer one-to-one comparison of what could be more useful. But they still use HPLC, you know. Uh, but some of it's also down to like the sensitivity limits, because NIR or some other types of spectroscopy could get a sort of accurate quantitation, but within the limits of like 0.3%, it makes those sort of systems difficult to use. So then you have to use a lot more expensive systems. So if there was an adjustment of these levels for instrumentation's sake, that would be great. But usually, to be honest, growing up in Vegas, the instrumentation limits are usually used against the end consumer. I like to use the 2 nanogram per limit used in DUI cases of cannabis consumption. 2 nanogram per limit is the limit set by the instrument. So if they detect it at all, it sounds like it's something from science, which technically is a true statement, but isn't really grounded in an effective approach. It sounds good. These are politicians setting these rules. It sounds good. Yeah, yeah. Let's get to the stream questions. I started in the industry 2016. This was Nevada, so this was actually just before the legalization took place in the state. Because I think it was like 2017 or 2018 when it was legalized. I was out of college. I had to make money because of family issues, and I was working in an environmental lab. Which any chemists watching right now, stay the hay away from environmental. That stuff is an awful industry to be in now, and the things that I've seen in it are pretty awful, and it's very hazardous, and they tend to really churn through people. A lot of the chemistry field, unfortunately, can be described in that way. It put me in the hospital, so I was pretty eager to get out of that job, and there was a cannabis lab that I was hiring, which was a startup, and yeah, that was like 2016. So I did that for 5 years, and I'm working on my current job, which I was the subject matter expert in their cannabis tests for GC, and I've been doing that for another 5 years. So 10 years in the industry. Not a lot of people can say that if you think about it. Yeah, I mean, strictly speaking, I got into the industry before it was legal. The startup was banking on legalization, and it was actually a franchise of a California lab which fell through. It's so. The question is, since I have so much experience analyzing food, what do I like better, sweet or salty? I'm not supposed to eat sweets. I have quite the sweet tooth, though. Salt, I definitely eat a lot of salt. I came from a very dry. I'm a desert cat, right? So you need a lot of salt to keep that water in. I'll go with salty this time. It is Degen Tech. Okay, so the question was, what about the negative health effects of cannabis, and do I have any comments on that? Right? Yeah, and there was like a comment of dementia. Okay, so I'm not a doctor. I'm an analytical chemist. I have my degrees. I have a bachelor's in biochemistry. So people with my degree would go into being a doctor, but I went to commercial science. So I don't really have anything that I can officially say. I do pay attention as much as I can to this. Some broad statements that I think are pretty safe, even as a non medical expert. Living a sober life is generally healthier than living an inebriated life. There are some very real downsides to cannabis. Cannabis is an addictive substance. It can cause a lot of issues for people who develop dependencies on cannabis. There are some health effects, knock on health effects. It does have a negative correlation with birth weight, and that's independent of smoking. That's consumption, like let's say with edibles. So pregnant women are not necessarily recommended to use it. It has some negative interactions with an anesthetic that's commonly used in emergency room situations and surgeries. So you want to be honest with your doctor if you consume cannabis, because there's certain anesthetics that are dangerous then for them to use. I believe it's like propofol. I could be wrong on that one. Um, with the dementia risk and such. There's that gets really tricky because people who have certain conditions, right, will use certain substances more preferentially. Outside of cannabis, I know there's like a little factoid of people with positive diagnoses of schizophrenia are way more likely to be tobacco users because it has a certain it has a interaction with the common neurological types with certain conditions. They're self-medicating. You seek what makes you feel better, and if it makes you feel better, that could be for many reasons. So it's difficult to say whether the people are having these conditions because of the usage or they're using it because of these conditions. Because dementia and schizophrenia, they don't present symptoms until the disease is reasonably well progressed, right? So initial symptoms may be pretty vague. Now, a little bit of a personal comment though. Nothing exists in a vacuum, right? We can always talk all day about what's good for you, what's bad for you, what's better for you, but this is something like, what are you going to be doing on what are the medical uses of cannabis, right? Pain relief. What are you going to be using as an alternative for pain relief? You're going to be using what? Ibuprofen or morphine or even like things like fentanyl, which decidedly I think would be a lot more dangerous than and have worse symptoms than cannabis. And from my interpretation of a lot of the health research of cannabis, the big cause of a lot of the benefits of cannabis, like they say, like weight loss, it has like certain benefits for your general health and metabolism and all of these things. Frankly, I think a lot of it has to do with that cannabis users drink less alcohol. So if we were talking about cannabis by itself, yeah, I could say like it's not really great for your health and there's a lot of downsides. But in terms of like what people are actually dealing with in their life, it's a better alternative. It's if you have a life where you need to have if you need inebriation for some reason, right? You have chronic pain, you have just I don't know, a bad mood. You have just something and you're turning to substances anyways. Cannabis is probably going to be one of the least detrimental, but there's still going to be detriments to it. And whatever the problem that you're using to help alleviate or mask or what have you, you're still probably going to want to treat those the core problems that are because cannabis has issues. It can cause issues with your sleep. It can cause people in extreme cases can cause hyperemesis syndrome, which will cause chronic vomiting. But if the alternative is you using like being an alcoholic or God forbid something like fentanyl or heroin, and the alternative is to be a stoner, well, of course, be a stoner. You know, it's that's clearly better. So it's cannabis isn't great, right? It's not a perfect thing, but in terms of the world that we live in, it's usually a better alternative. That's the best I can say. Otherwise, and I'm not a medical professional, so there's a lot of things that I really shouldn't comment on. Because I needed a paycheck. Um, Yeah, I don't want to get into my personal issues, but we all have real lives that we need to attend to. And as much as I was hoping to be like the magical whiz kid that cured cancer or whatever, um, I came from the background I did. I didn't exactly have an exact clue of what I wanted to do. I knew that I wanted to be something technical. I have uh, let's say the things I was trying to avoid as well in my life. So I was junior, senior in biochemistry. It was tough, but I was making it work and I was trying to think of what the future was. Before that, I was a high schooler trying to figure out what the future would be. Everyone was telling me, go into computers, do coding, whatever. Well, I ask you, what's happening with the computer engineers now? A lot of them are getting laid off because of AI systems. And I had an issue where I really want to do biotechnology. I have a whole thing about how the progress of society is largely built upon food, sometimes medical advancements, but really understanding soil is probably one of the most important things we can do as a human species. But nobody really cares about that. It's about the money, baby, right? So when I was outside of college, I had some family issues that I had to take care of, so I had to put my personal development goals on hold. And I had to start earning money, baby, or else the streets would be my home. So I didn't want to transition outside of chemistry after getting a 4-year degree. So I started at $13 an hour in an environmental lab that put me in the hospital because they didn't decide working on the fume hood was worth. They didn't decide telling me that they're working on the fume hood was worth my time. So I put a emergency room bill on their tab. And I've ever since then, it's just gas chromatography is profitable, and that's the nature of commercial chemistry and commercial anything. Once you have a role, they're going to keep you in that role, and they're going to keep you working in that role, because once you're good at it, there's no real benefit to the company to have you have multiple roles, because that's just going to stress you out and make their own procedures less relevant. So I ended up hyper specializing in something that I really had zero interest in actually doing, and I had dreams of going back into biotechnology, but honestly, that's part of the reason I made this group, by the way. I think we all have some frustrations in our world and our careers and such, and sometimes just reaching out to the people who have at least similar kind of experiences to you can really give you the advice and input and direction that you can actually use, and hopefully maybe open some opportunities. All right, so good question, actually. Synthetic. All right, so the question was, do I have any particular opinions on synthetic cannabinoids? Sort of. Synthetic cannabinoids, the big first one was JWH018. That was quickly made illegal, and then there was a number of other ones that followed that were analog modifiers. I think this is actually a good example that could be worth its own lecture, but chemistry, organic chemistry, you know, popping molecules and changing their shapes and all of that, it's really advanced to the point where you can computerize it, and it became a lot more predictable as long as you're operating within certain bounds. I wish my hand was more predictable. So the JWH018, by a lot of reports, and you can go to arrowid.org, great website, y'all, it's arrowid.org, to read up on some of the usage reports of it. And there were some downsides to JWH018, because if I remember, it had like 100 or so times greater binding potential to the same cannabinoid receptors as cannabis. So it caused certain people to have like seizures and such. But in terms of the reports, I'm not extremely hearsay and anecdotal evidence is not extremely scientific, but when you have a lot of it, it does indicate some trends. It wasn't as bad as what followed, right? So sometimes good intentions lead to worse results, and it's really important for me to point out that nothing we do operates in a vacuum. So just like I said with cannabis, if the direct answer question is like, is cannabis good for you? No. Is synthetic cannabinoids good for you? No. Is it worse than cannabis? Yeah. Right? But that's not a very full answer, is it? So once they made JWH018, they started altering the compound in order to have things that are legally available. And what do those things have? 1,000, 10,000 times binding potential to the same cannabinoid receptor. And maybe the synthetic roots were contaminated with some weird material and residues. So now you have people actually getting seizures and some really crazy side effects from, you know, gas station weed, as they called it. So it's a lot of this is also just because people can't smoke regular weed. They're afraid of losing their job. Every single person I talked to who smoked spice was like, I'm afraid of being drug tested, you know? So it's really jumping out of the frying pan into the fire. But these people are kind of being pushed from like the outside, because really it begs the question, it's like, what's so bad about pot? The Vietnam War is over. Can we just have what people actually want? It's a lot safer and cheaper and accessible, and so the synthetic cannabinoids, I think, is a good example of both organic chemistry, how legal language works, and how it actually affects society, and how I really wish there was at least a few scientists in government. I'm actually dealing with that right now. The technical answer is yes. You know, yeah, sure. I wouldn't recommend it, because you're like, okay, what are you injecting then? Are you injecting something that's so pure that, like, you know, there's only one thing? Because if it's more than one thing, it's all going to hit the detector at once. And not to mention, like, if you want to sit down and do the mathematics of like how many molecules are hitting the detector, granted, 10 to the 23rd is a massive number, and the number is still going to be like many thousands, but it's still like a very small amount of physical material is hitting these detectors. So if you want to just like stick a syringe and squirt it and see what happens, I wouldn't recommend it. You're going to need to do something to limit the flow onto the systems. But the technical answer is yeah. Just like you can, I don't know, flood an engine with gasoline, and just you can, like, there's a lot of things you can do. It's just, but you want to get the results you probably want. But some people insist. Some people do insist, and honestly, sometimes I wonder if they're like doing something nefarious. Fun fact: the one of the earliest uses of a mass spectrometer was in the Manhattan Project because that's a way to enrich uranium. So sometimes I wonder that if somebody's like, I just want a mass spectrometer, I'm like, okay, that's kind of a weird thing to buy by itself, but all right. It's extremely inefficient to do it that way. Like to the point of like, if you try it, you're going to get the results of people just breaking in your door. Don't do it. Oh, interesting. I mean, we're both like similar aged men. We're both like techie people. Thank you. Cool. I got a couple personal takes coming up because I want to use my stage time while I have it. Do we have? Yeah. Do we have any questions from this audience in VR? All right. And I think the streams are answered for. Okay. So that's the Q&A section. But while I had the stage, especially that the audience of DGen Tech has grown so much since I started doing this lecture series, I wanted to like kind of talk about some of these cool nerds that I really come to know and love and like help organize and do all and really spend some great times and have some great life memories with them. And of course I'm talking about sword fighting. I love this stuff. I always help lecturers in this group to like talk about themselves, and this is my own shameless self plug. I do a lot of sports sword fighting in my real life. It's something that I just can't show in my VR side of my life, but this is my digital self. This is my analog self, right? So quite the display of different characters, right? So I love if you guys ever have any interest of reliving your 5-year-old self trying to hit your friends with sticks. Turns out adults still do this. You can still be like that. You just have to think about it, use the right gear, but it's completely doable. So I'm giving a shout out to Belagarth because that's one of the main ones that I'm doing. But HEMA, Historical European Martial Arts, we have Buhurt, Fencing, Kendo, Amtgard, Adria, Society of Creative Anachronism, and multiple more. It's just something that people can still do. Another website I want to throw out is cometrylarp.com. Cometrylarp.com. I do sports sword fighting. I've been competitive in it, and if you guys want to try like a kind of dorky martial art, right? It's still it still teaches you things. It's really engaging and it keeps you healthy. I highly recommend it. And talk to me if you ever wanna know anything about this or cannabis. I make the joke that my life is really just cannabis and sword fighting. So yeah, now, of course, I have the other part of why we're actually all here. I want to talk about DGen Tech, all right? Sorry for the mislead. I couldn't help myself. But what this group actually is we're DGen Tech. This lecture, we've been doing the YouTube lecture series for approaching a year now, but this group has actually been meeting on VR for like 4 years at this point. We're a group of working furries in virtual reality. We're furries that work in the STEM fields, so science, technology, engineering, mathematics, and medical. We're a bunch of techie dorks, the stereotype of like furries make up half of IT. They also make up a lot of laboratories. They make up a lot of researchers. I could go into my ideas as to why this happened, but this is an extraordinarily creative, extraordinarily techie community, and VR I think is a magic sauce that kind of let things mix together a little bit better. So DGen Tech is and now like it's a whole community that we've come together and really started helping make. We've had Apotech as our co-admin, and in the audience we have Snur and Sky as our moderators, and we have a bunch of other moderators. We're collaborating with other groups on VR. Seriously, there's a magic in virtual reality. I want to point out we now have VRChat, Resonite, YouTube, Blue Sky, Reddit, and Discord. So check out our other social media places. But the main place that we'd like to hang out in is VRChat. Because honestly, there's something magical about VRChat. I can't express it. It was, to me personally, life-changing, and I'm kind of inviting everyone to check it out and really come take part in it. We've have people from across the world in a whole bunch of different vocations with a whole bunch of different lifestyles and types of personalities and people, and we all come together to share our experiences and knowledge with one another. And Degen Tech is just one attempt at getting like the techie people together. We have a whole bunch of different lectures. We've had a whole bunch of different types. We're coordinating with a bunch of different groups as well on VR, and we're really getting integrated with the whole social fabric of the virtual space. And I welcome you guys to come and check it out. I really enjoy and I've really come to love the community that makes up Degen Tech and the opportunities and the experiences that you guys have enabled and made possible. This started as kind of like people that you know and things, and it has really grown and taken off into something more. And I want to thank you all for making that possible. For everyone who's watching on stream, come out, check out the virtual space. If not for us, check out for other things. There's so much that's going on here, and I do think that this is the future. There's definitely some quirks to work out, but like any technology, but this feels significant. There's something to this, something magical about this space. So please come join the experience. Thank you very much for making my experience, and I hope you enjoyed this lecture. Thank you.